Have you ever gotten a lab report back from your doctor and felt like you were trying to read, I don't know, a foreign language? You are so not alone. Today, we're going to crack the code on one of the most common and most important tests out there, the complete blood count, or CBC. We're going to turn that confusing jumble of letters and numbers into a story you can actually understand. So let's just start with this question. What secrets are hidden in a single drop of your blood? I mean, did you know that one little drop contains millions of tiny cells, and every single one of them holds a clue about what's going on inside your body? It's true. For the next few minutes, think of us as medical detectives, and this drop of blood, it's where our investigation begins. So what exactly is a CBC? Well, think of it like a snapshot, a really detailed picture of your bloodstream at one specific moment in time. It's a totally routine test that just counts and measures all the key players floating around in there, and it gives doctors this incredibly powerful tool to get a read on your overall health. Okay, first section, secrets in your blood. Now, before we can even start to understand the report, let's just quickly talk about the test itself. I promise it's way simpler than you might think. The whole process is super straightforward. I mean, look at this. It all starts with a simple blood draw. Then that little sample gets sent off to a lab, where this amazing machine, an automated analyzer, does all the heavy lifting. It counts millions of cells with incredible precision. And finally, your doctor gets the report to go over with you. For you, the patient, the whole thing is usually over in just a few minutes. All right, let's meet the first key player that the CBC reveals. I like to call them the oxygen crew. You probably know them as red blood cells, and they are basically in charge of your body's entire transportation network. So, red blood cells, or RBCs, are your body's oxygen delivery specialists. Their whole job is to grab oxygen from your lungs and then deliver it to every single cell in your body. And they can do this because of a special protein inside them called hemoglobin. That's also what gives blood its classic red color. Seriously, without this crew, our bodies just wouldn't have the energy to do, well, anything. So, how do we check in on this crew's performance? Well, your report looks at three main things. First up is the RBC count. That's literally how many millions of these cells are packed into a tiny drop of blood. Next is hemoglobin, which is that all-important protein actually carrying the oxygen. And finally, hematocrit, which tells you what percentage of your blood is made up of these red cells. Now, these are the typical ranges, but remember, they can be a little different from lab to lab. And what are these numbers telling our detective? I mean, our doctor? Well, a low count might point towards something like anemia or maybe a nutritional issue. On the flip side, a really high count could be a sign of dehydration, or sometimes it's just your body adapting to something like living at a high altitude. But the key word here is clues. These are just clues, not the whole story. Okay, next up, let's talk about your body's personal defenders, the immune army. These are your white blood cells, or WBCs, and they are on patrol 24/7, looking for trouble. You know, white blood cells are literally the warriors of your immune system. Their whole mission is to find and destroy invaders, like bacteria and viruses. What's really cool is that the CBC breaks this army down into its different special forces units. You've got neutrophils, which are kind of like the first responders to a bacterial infection, and then you've got lymphocytes that are pros at targeting viruses. Each one has a very specific job to do to keep you healthy. So how big is this army? Typically, we're talking about 4,500 to 11,000 of these cells per microliter of blood. The best way to think about this number is as an activity meter for your immune system. It lets your doctor know if things are pretty quiet or if there's a major battle going on. So if the army's numbers are off, what could that mean? Well, a high count often signals your body is busy fighting something off, like an infection. A low count, on the other hand, might be a clue for other things, maybe an autoimmune condition or an issue with the bone marrow where these cells get made in the first place. Okay, our final key player is the internal repair crew. The first responders. These are your platelets, and they are truly the unsung heroes of your blood, always on standby for an emergency. Platelets are these tiny little cell fragments, and their job is absolutely critical. Anytime you get a cut or an injury, these first responders literally rush to the scene. They all stick together to form a little plug, a clot, to stop you from bleeding. I mean, without them, even a paper cut could be a pretty big deal. And you won't believe how many of them we need. Just look at that number. A normal count is somewhere between 150,000 and 450,000 per microliter. It's a staggering number, right? And it makes sure your internal repair crew is always fully staffed and ready to go at a moment's notice. Now, having the right number of platelets is a really delicate balance. If you have too few, it can cause problems like easy bruising or bleeding that won't stop. But having too many can be risky too, because it raises the chance of your body forming unnecessary blood clots inside your vessels.
Okay, so we've met the oxygen crew, the immune army, and the first responders. But here's the most important part. A CBC report is never about just one of these numbers. It's all about putting the clues together to see the whole picture.
And listen, if you've ever looked at a lab report and just felt your eyes glaze over, if you felt completely overwhelmed, you are definitely not alone. It's a super common feeling. But just understanding the basics, like we've been doing, is the first step to making it all a lot less confusing. So here is the most crucial point, the main takeaway. One number being a little high or a little low does not solve the case. It doesn't automatically mean something is wrong. It's just a single clue. Your doctor is the lead detective who takes that clue, puts it together with your symptoms and your history, and figures out what's really going on. And that's because so many different things can affect your results on any given day. I mean, just look at this list. Everything from being a little dehydrated, to the supplements you take, to being stressed out, or even going for a hard run. All of these things can temporarily shift your numbers. Context is absolutely everything. Which brings us to the most important point of all. This explainer is here to help you understand your report, but it is absolutely not a tool for self-diagnosis. The only person who can truly put all the pieces together is your healthcare provider. They're your partner in all of this, helping you understand what these numbers mean for you. When you get right down to it, your CBC is telling a story. It's a detailed, fascinating story about your health, just written in the language of cells. And now that you know the basics of that language, you're more prepared than ever to have a really good conversation with your doctor about what your personal story says.